Hey everyone! Welcome back to the channel. Today, we're diving into something many of us have experienced but don't fully understand: sinusitis. Why does your face feel like it's going to explode during a cold? Let's talk about it. What is sinusitis? Sinusitis is an inflammation or swelling of the tissue lining the sinuses, those hollow spaces in your skull that are supposed to stay air-filled. But when they get blocked, bacteria, viruses, or even fungi can grow, causing an infection. That's sinusitis. Your sinuses are located behind your forehead, cheeks, and eyes. When they get blocked, boom! Pressure, pain, and mucus. Types of sinusitis. There are actually 4 types of sinusitis. 1. Acute bacterial sinusitis. Consider if symptoms greater than 10 days, high fever, greater than 39 degrees Celsius, purulent discharge, facial pain. First-line antibiotics, 5 to 10 days. Amoxicillin clavulinate. Alternatives, if penicillin allergy. Doxycycline. Levofloxacin or moxifloxacin, for complicated/resistant cases. Adjuncts. Intranasal corticosteroids. Saline rinses. 2. Subacute sinusitis, 4 to 12 weeks. Subacute usually refers to a condition that is less sudden than acute but more recent than chronic, typically developing over days to weeks. So, subacute synesthesias might describe a recent onset or temporary form of synesthesia, potentially linked to medication side effects. Neurological events, example seizures, migraines. Psychedelic drug use, example LSD, psilocybin, DMT. Post-viral neurological symptoms, example after COVID-19. Toxic/metabolic encephalopathies. In these cases, the synesthetic experience might begin unexpectedly, be transient or reversible. Subacute sinusitis, or syncope. Let me know. It's possible you're referencing another medical term and just need clarification. 3. Chronic sinusitis, 12 weeks or longer. Chronic sinusitis. Greater than or equal to 12 weeks of symptoms, often with nasal polyps or allergies. Medical treatment. Intranasal corticosteroids, daily. Saline nasal irrigation. Treat underlying allergies, example antihistamines, immunotherapy. Short course of oral corticosteroids, if severe. Long-term low-dose antibiotics in some cases, controversial. Surgical treatment, if refractory. Functional endoscopic sinus surgery. For recurrent sinusitis, several attacks in a year. Recurrent sinusitis is a condition where a person experiences multiple episodes of acute sinusitis, sinus infections, over a period of time. According to most medical guidelines, recurrent acute sinusitis is defined as 4 or more episodes of acute bacterial sinusitis per year, with complete resolution of symptoms between episodes. This is different from chronic sinusitis, where symptoms last continuously for more than 12 weeks. Causes and risk factors of sinusitis. So, what causes sinusitis? Viral infections, like the common cold. Allergies. Nasal polyps. Deviated septum. Fungal infections, rare but possible. Even air pollution or smoke can trigger sinus issues in sensitive people. Symptoms of sinusitis. Wondering if your stuffy nose is more than just a cold? Look for these sinusitis symptoms. Facial pain or pressure. Nasal congestion or discharge. Loss of smell. Cough or throat irritation. Fever, sometimes. Fatigue. Bad breath. If your cold lasts more than 10 days or gets worse after getting better, it might be sinusitis. Diagnosis and treatment. Sinusitis. Doctors usually diagnose sinusitis based on your symptoms, but sometimes they'll use imaging like a CT scan or nasal endoscopy. Treatment depends on the cause. Viral sinusitis? Let it run its course. Decongestants, saline rinses, and rest help. Bacterial? Sometimes antibiotics are needed. Chronic or allergy-related? You might need antihistamines, corticosteroids, or even surgery in severe cases. Try a neti pot or saline spray for natural relief. Just make sure the water is sterile. When to see a doctor? See a doctor if symptoms last over 10 days, keep coming back, or are severe, especially with a high fever, swelling, or vision changes. Sinusitis can be a real pain in the face, literally, but knowing what causes it and how to treat it makes all the difference. If you found this video helpful, give it thumbs up and don't forget to subscribe for more health tips every week. Breathe easy, and we'll see you next time.